And welcome back. I'm here with Ashley Tarantino of the Swallowing Clinic, and she's here to tell us if maybe you may be a candidate for the Swallowing Clinic. Ashley, thank you so much for joining us. It's great to have you.
Thank you. It's nice to be here.
Okay, what is the Swallowing Clinic of Northeast Louisiana?
Okay, well, thank you for letting us come educate the public. Yeah, we are a clinic. We are specifically designed to help people with swallowing disorders. The technical term for it is called dysphagia. We can help with swallowing disorders and with any sort of facial drooping that people have, maybe from Bell's palsy or anything of that nature.
And how does somebody know if they're a candidate or there's somebody who can benefit from the Swallowing Clinic?
Well, aside from the most obvious, you know, if you were to put something in your mouth and chew it and swallow it, or even a liquid, if it gets stuck or if it feels like, you know, you're having to cough, then that's a possibility you could be having a swallow issue if that's a continuous thing for you. Some other things that kind of go that you don't really realize could be a symptom would be watery eyes when eating or drinking, runny nose with eating or drinking, and the one thing that we always really try to educate people about is if you're consistently clearing your throat throughout the day, and it's a common thing, it's a possibility that you could be having trouble swallowing your saliva.
What causes that? I do know a couple of people who have trouble swallowing, and it's kind of pretty miserable for them, actually.
It really is. And you know, as far as the causes go, there could be several different types. You know, some people, it is due to age, because a lot of the reasons why you may have swallowing problems is because your muscle function could be weak. But not always, because, you know, I've had people as young as 12 years old come into my clinic with swallowing issues. So, you know, it really just depends. We always like to say that if you feel like there could be any chance that you would have a swallowing problem or just even have a question, call us. You know, you're going to call the number, you're going to talk to me every time, and I'll be there to answer any questions that I can. And if I can't answer that question, the therapist can, and we just kind of go from there.
What happens when you first come into the Swallowing Clinic? How does the consultation go?
Process is super easy. You come in. I'm getting your insurance information over the phone when you call, so there's not much paperwork. We go ahead, we get that insurance information if you have it. Even set up. It just kind of depends on your insurance, but you come in, you sit down, you sign your name on a few forms. Obviously, we have a little bit of, you know, housekeeping to take care of there, but as soon as you're done with that, you are in and you are talking with our therapist. And you know, most people who come into our clinic and have stayed with us, they become family. We try very hard to make it a very friendly, inviting atmosphere that you're comfortable in.
What does treatment involve, and is it painful, and what success do you see?
Definitely not painful at all. Right. The treatment it's called Neuromuscular electronic stimulation. Basically, it is feels a little bit of a tickle on your throat right here. And when you come in, we're really kind of able to assess kind of what you're needing at that time, but that is the primary therapy that we provide. And it's like I said, it's not painful at all. You come in, you sit down. Most of the time there's people there, you're chatting away, and it's a really easy thing to do.
How can somebody get more information and get in touch with you, Ashley?
Well, easy. The Swallowing Clinic of NELA.com. You can give us a call at 318-460-5150, and we have a Facebook page, The Swallowing Clinic of NELA. So,
all right, The Swallowing Clinic of NELA, located in Monroe. Ashley Tarantino is here to answer all your questions. Thank you so much for joining us.
Thank you.
Up next.